Oligodendroglioma. Oligodendroglioma is an intraaxial tumor. It is slow growing tumor. It is a benign tumor, and WHO classify it as a grade 2 tumor, that is low grade tumor, but that would be well circumscribed. Grade 3 tumor would be a high grade tumor, and it would be anaplastic. So far its location is concerned, it's mainly involved the cerebral hemisphere, seen in young adult in their fourth decades. It may erode the calvarium. It happens to be infiltrative, but not as much as you can see in infiltrative astrocytoma. Beside this, 90% calcification can also be seen. It is sensitive to chemotherapy, or you can call it is a chemo sensitive. So how it will appear on the ultrasound imaging, how it will appear on the CT and MRI imaging, we cannot see that on the ultrasound imaging. So we are going to look for the CT scan and MRI, and how we will appreciate it, what are the characteristics on the CT and MR images. These next slides will also explain all these categories. So let's start watching these images. On this non-contrast axial CT images, you can appreciate a well-defined cerebral hemisphere lesion with a midline shift, and you can also see intratumoral necrosis in it. It is a uncapsulated lesion. It is well circumscribed, and it is quite infiltrative. You may be able to see calcification in 90% of the cases. This is how the oligodendroglioma will look on the CT images. Another example of the oligodendroglioma, you can appreciate that this is involving the peripheral side of the parietal lobe. However, this is quite common in the in the cortical region of the cerebral hemisphere, no doubt, where it is maybe most commonly involving frontal lobe or parietal lobe as well. This is a well circumscribed uncapsulated region. This is however not that much infiltrative and diffuse, as it happens to be in diffuse astrocytoma, but it usually appears in hypodense and involving the cortex, and it also causes cortical thickening as well. In that case, you cannot particularly see the hemorrhage. However, normally in oligodendroglioma there will be calcifications. Another example of oligodendroglioma, you can appreciate it is involving the cortical part, it is involving the frontal lobe, and 90% you can see the calcification. Here you can appreciate the calcification. It happens to be a hypodense in nature, and it has also caused the midline shift. Beside this, on the image you can also appreciate the hydrocephalus, which is not likely due to the oligodendroglioma, because that is a far from the hydrocephalus. There will be some other reason for the hydrocephalus, but apparently here on that particular CT images you are able to see the oligodendroglioma with significant calcification, which is the characteristic of oligodendroglioma, always occurring into cerebral hemispheres, and hypodense in nature, and with the presence of calcification. In 20% you may be able to see the hemorrhage within it. Here is another example of the oligodendroglioma. Happens to be a very well-defined hypodense lesion involving the frontal lobe with a dense calcification within it, and it is involving the cortical part. In few cases you may be able to see the hemorrhage. It is not that much infiltrative as the diffuse astrocytoma happens to be. So this is what the oligodendroglioma will appear on the CT images. A few other examples of the oligodendroglioma on these images, you can appreciate that these are hypodense lesion. On the top images you can see well defined hypodense lesions involving the frontal lobe, while in axial and coronal images in the lower you can appreciate that there is a dense calcification within the lesion. So on the both axial and coronal you can see that there is a dense calcification in the oligodendroglioma. Here again, another example for the better understanding a well-defined hypodense lesion with the calcification. This is what the characteristic of the oligodendroglioma is. So this all cases indicate that the lesions were hypodense. Lesions was not too much infiltrative. There was not significant surrounding edema as compared to other lesions, and there was a lot of calcification. 90% there will be calcification in oligodendroglioma. I would sum up the case with a few words of explanation that the oligodendroglioma is benign and it's a slow growing tumor. It happens to be a hypodense. It is however diffusely infiltrating, but not that much as diffuse astrocytoma happens to be. It's always well circumscribed. It is non-capsulated or uncapsulated. In few cases it may erode the calvarium, but the more important point is that there will be intense calcification. 90% will demonstrate calcification. In 50% of the tumor, this they will appreciate, they will explain, or they will present with the heterogeneity after the contrast enhancement, and there may likely be intratumoral bleeding. So I do hope this would be an sufficient information about the oligodendroglioma, and on the CT images you would be able to recognize oligodendroglioma. Keep watching my video, keep sharing with others, and with some other information. We'll see you next time. Take great care of yourself.